So just to kick things off, because this is a question I get really often, fasting,
Oh, yeah.
intermittent fasting.
Yep.
We need to distinguish between the two, of course.
Yep.
Perhaps the most common question I get as it relates to males versus females is intermittent fasting, or time-restricted feeding as it's sometimes called, an 8-hour feeding window, a 6-hour feeding window, a 10-hour feeding window. Is that something that perhaps differs in terms of its impact and how well it works for men versus women?
Yeah. That's the short answer.
Great.
Yeah. So I'll put some parameters around it, right? So if we talk about intermittent fasting, that's where you have like the 20-hour non-feeding window, or you're holding a fast until noon or after. And then we have time-restricted eating, and that's the fancy way of saying normal eating, where you're having breakfast and then you stop eating after, or you don't have anything after dinner, right? So you're eating with your circadian rhythm during the day. If we look at intermittent fasting, where you're holding the fast up till noon, or you're having days of really low calorie restriction, we see in active women it's very detrimental, unless you have PCOS or you have some other subclinical issue.